Sounds good.
All right, so their range of motion will be restricted, and I'll be bringing them through different ranges such as abduction, flexion, external rotation, and internal rotation. I'll bring it to a point where I feel their tissue kind of restrict against me, and typically that'll be a little uncomfortable. I'll try to push a little bit beyond that to get those tissues to stretch out. Bring it back down, and hopefully by the end of the treatment, or the end of this part of the treatment, people will have a little bit more range of motion.
Is there anything that you do with the tissue around the shoulder? I mean, is there... so this is what they're doing first when they come in, or is this something that happens later after therapies?
This will typically be later in the treatment. Sometimes we'll start them off with heat to the shoulder, moist heat in the beginning, which feels good, helps increase circulation to that area. We'll loosen up the tissues, and then we'll bring them back here for some exercises, and then we'll end with this manual treatment. So the passive range of motion is one thing. Shoulder impingement is something we were talking about in studio, which is where the ball of that ball and socket joint doesn't quite glide downward when you're moving your arm up and out to the side or out to the front. So the space is lost in between those two bones there. So there's jamming. The bones approximate and pinch all the rotator cuff tendons, biceps tendon in between. And a lot of times that'll happen because there's not enough inferior glide of that humeral head. So we'll try to take our hands, put it right along the humerus there, the proximal humerus, and then try to glide that humeral head downward. So there's more space created in between those two bones with certain motions of the shoulder. So less pinching, less of that impingement we were talking about.
What other exercises are you teaching people to do both here and at home?
Yeah, so like I said, range of motion is the thing we want to get back first. So a lot of the things we show people in the beginning are to get back that flexibility. We hold off on the strength things until that full range of motion is attained. So there'll be different exercises using a cane, let's say. And I'll have Brian just push up in front of you, and then we want to try to get back some shoulder flexion. So say he's losing a lot of this motion here, can't attain full range, can't bring that arm up by his ear. He'll be lying down like this, and let's say it's his right arm. He's going to be using his left arm and the stick to kind of guide that right arm back. Say there's a restriction right there. He can use his left arm and the stick to help push that downward to attain some stretch of that soft tissue and allow that shoulder to go through its full range.
Is that similar to a wall crawl if somebody's going up and doing that? So if they stand against the wall and run their hand up the wall so they can get that?
Yes.
Is it similar? Okay.
Yeah, so that would be flexion if you're facing the wall and you're crawling up. And then with the stick, we'll also show people abduction exercises. So I'll take the stick. We usually have them standing for that. So if they're losing abduction, which is the ability to raise your arm up and out to the side, we'll use their, say, good arm to push the affected arm up and out to the side. So the left arm's doing all the work, the right arm's staying relaxed and trying to get a stretch into that abduction motion.
Okay. So what other types of exercises might somebody see?
Well, after we get back, close to full range of motion, that's when I said we would want to start working on the strengthening exercises. So rotator cuff, that's a huge, it's actually a small muscle group, but it's huge in shoulder function. So a good exercise for that would be side lying. So Brian's going to lie on his side. And he's going to have his elbow kind of pinned up against his ribs there, and then he's going to rotate that arm right up into that range there and back down. And that's going to work that rotator cuff right here. So, and we gradually progress the weight, as the exercise became easier to build up that strength.
And if people, what do you tell people when they're at home? Things that they should be careful of.
Just not to overdo. So discomfort while you're doing the exercise, a little muscle fatigue or burn is okay, as long as after they stop doing the exercise, that type of burning sensation or pain dissipates, shortly after, within a minute or two.
Okay.
If it lingers all day, they're probably going too much, go with too much weight, and we would tell them to back off a little bit.
So you're getting feedback from patients and then adjusting the exercises, their home regimen, if you will?
Right.
Okay. Why don't you show us another exercise or two, and let's jump into the therapies. Let's see what you're doing with people. I think they're going to want to see some of the therapies as well. So what other exercises are prominent in shoulder rehab?
A lot of times people will overlook the scapula stabilizers. So the scapula is the anchor for the shoulder. So you want that to be nice and stable before you really start working the rotator cuff and, you know, the muscles around the shoulder there that attach. Okay. You want to start working these stabilizers here because that's your anchor. And a good exercise for that, or a good couple of exercises, would be prone scapula stabilization exercises. So Brian's on his stomach there, and I'll have him scoot over so his arm's hanging off the edge. And then he's just going to bring his arm out to the front. Okay? So that's going to work the lower trap right down here by the bottom of the scapula. And if he raises his arm up and out to the side, with different arm positions during that motion, we can work the rhomboids and the middle trapezius. Okay? And then just going into extension, we're going to work that posterior deltoid and the other muscles around the shoulder blade there.
Do you think a lot of shoulder injuries occur because of that area that you're talking about that needs stabilization isn't strong enough in the first place? That people aren't getting the kinds of exercise or the kind of activity that involve those muscles in the first place?
Definitely. All these scapula stabilizer muscles back here, these scapular retractors, are the muscles that basically help promote good posture. So the stronger we get those, the better. The more retracted your shoulders are and better posture you have during the day with daily activities, the less likely you're going to get impingement in the shoulder. If you bring your shoulders forward and try to raise that arm up, and that's about as far as I can go right now before I start feeling a restriction. I'm getting a pinching right there.
That makes
if I bring
sense.
the shoulders back, it opens up the shoulder joint, and you have more space in there to freely move through that range of motion, so not as much pinching.
I like that. That makes sense. Why don't you show us a few therapies and what are some of the things